But over the weekend, we learned that former President Biden was diagnosed with an aggressive form of prostate cancer. This diagnosis came after he experienced urinary symptoms. So here to help us try to understand what this means for the former president's short and long-term health, we have Dr. Brian Helfand. He is Division Chief of Urology at Endeavor Health. Dr. Helfand, thank you very much for being here on the program. We appreciate it, sir.
Good morning.
All right, so based on what we know, doctor, how serious is this for the former president?
So the prognosis should be actually quite good. And even though it is an aggressive type of tumor, and should be taken very seriously, overall with treatment, we can likely control this type of tumor and still have a good prognosis. Of course, a lot of this is really dependent on his other medical issues. Often prostate cancer, even aggressive forms, are slow growing. So it is really just somewhat of a ticking time between how the prostate cancer ultimately could progress and his other medical issues. But overall, from a prostate cancer standpoint, his prognosis should actually be quite good.
So what options could be on the table here for the president in terms of, for the former president in terms of a path forward here?
Right. So to the best of our knowledge, at the time of his diagnosis, his prostate has already spread outside to a local bone. It is unclear yet how advanced or how many sites that it has spread to. Nonetheless, this can certainly be controlled usually with medical therapies. And when I say that, I'm really referring to drugs that decrease or stop testosterone production. And the reason being is that prostate tumors really feed off of testosterone. And by blocking its mode of action, it will actually starve, if you will, these tumors and keep them under control for certain amounts of time.
So under control as opposed to eradicating it completely?
It is possible that could be still on the plate, but however, usually once it's spread outside of the prostate to other sites, and this is why it's dependent on how many sites it's spread to, that usually the mainstay treatment is what we call systemic therapy that covers the whole body, because there are likely cells throughout his body that may not be covered by just a targeted type of therapy, meaning that men who have cancer that is localized only to the prostate, it is certainly much easier to eradicate and cure patients. That's where radical surgery or radiation really comes into play. This still may be possible if the spread has only been to one or two sites, where they can also potentially not only give him that anti-testosterone therapies, but also focus in on radiation. But that will really remain to be determined as he is worked up with additional scans.
I know there's a lot of variables at play and a lot of unknowns at this point, but what do you see this doing to his own livelihood here in the next few years? I mean, he's 82 years old, he's no longer in office, but will he be able to be up and about, go to public functions, that kind of thing?
Yeah, in general, the hormone therapies are well tolerated. However, there are common side effects where he may feel a little bit more fatigued, a little bit more tired. He may have common, what we usually refer to as menopausal type of side effects, meaning he may get hot flashes, be more prone to weight gain, things like that. But in general, men who are on these therapies are really quite functional and can often do all of their normal activities of daily living.
Okay.
Of course, to combat a lot of this, we encourage patients to stay active, to exercise, and fight a lot of these side effects as much as they can.
I'm getting the wrap, but really quickly, while we have you on the line here, Dr. Helfand, this should serve probably as a reminder to a lot of, especially men who are upwards in age. What is your message for others and advice for others with regard to this diagnosis and the need to get screened?
Yeah, so remember, he's a little bit different because he presented symptomatically. We generally refer to screening, and it is extremely important that every man have that discussion with their primary care physician about the importance of screening and if their eligibility for screening. Our current guidelines for average risk men without a family history or who are white race is generally starting screening the age 55 and stopping screening age 75. Now, there are a lot of nuances that are in that, but in general, we encourage men to have these conversations because it is the most common type of cancer, and if found at a time when it is localized to the prostate, very curable and treatable.
Okay, great message. Dr. Brian Helfand from Endeavor Health, thank you so much for your time this morning. We appreciate it, sir.
Thank you.